leg shimmies, body shimmies, pelvic tip.
Yes.
Here we go. This is real. This is science. Welcome to our newest episode of DocTalk, where we unpack things in the news with a doctor, Dr. Choi. Today we're going to talk about something that you've probably been hearing a lot about. I've been hearing a lot about. It's buzzy, as the kids say, and that is pelvic floor. It was just when we were talking about this episode, someone just said to me, won't name names, make sure people know that everyone has a pelvic floor and not just women. So we'll start by saying we're going to talk specifically about women today, but everyone has a pelvic floor, and it's really important in quality of life for many women in particular. Pelvic floor muscles are associated with pregnancy, postpartum recovery, and aging, but the truth is it's a fundamental part of everyone's well-being, and particularly for women, for all ages and stages. So let's jump right into it.
Sure.
You like it?
Yeah.
Okay, so first question. What is a pelvic floor?
So a pelvic floor, as Lisa said earlier, everybody has a pelvic floor, men and women. And it's a series of muscles. Think about it just conceptually as a little sling or a hammock for some of your innards, your organs. So for women, it helps. It's the levator ani muscles. This is also true for males. The coccygeus muscles, and then the urethral and anal sphincter muscles. And so those muscles form this like little cradle, right, if they're functioning well, and sometimes not so well, to help support things like your bladder, your uterus, your rectum, and for males, everything except for the uterus, which they wouldn't have. And both males and females can actually suffer pelvic floor dysfunction and have symptoms from them.
And so, as you sort of mentioned, pelvic floor issues are common. Overall, nearly a quarter of women in the U.S., and when we say women, we mean people who are female sex assigned at birth. Over a quarter of women in the U.S. develop pelvic floor issues, according to NIH. Mm-hmm. Women aged 20 to 39 are less likely to experience symptoms, but I'm sure that happens too. However, about a quarter of women in their 40s and 50s do have pelvic floor issues. The percentage increases with age, with over half of 80-year-old women having pelvic floor issues or problems. So, my question to you, Dr. Choi, what are the symptoms of a weak pelvic floor?
So there are all sorts of different pelvic floor dysfunction disorders, but a weakened pelvic floor, which tends to happen very commonly as we age especially, you can have some signs, things like leaking urine. So let's say you're watching a comedy and you start laughing, and you notice that your underwear is a little wet. That's one sort of symptom, urinary incontinence. Feeling the urge to pee, even though you have done all the testing for a UTI, urinary tract infection, and you don't have any bacteria or an infection. That can be a sign of pelvic floor weakness. Fecal incontinence, unfortunately. I've had patients in the past where they couldn't control their bowel function. And other people will concomitantly or separately report things like pelvic organ prolapse, so feeling as though they have some pressure or weight in their pelvic floor, in their vagina, and then lo and behold on exam, I'll see a cervix protruding from the vaginal opening, for instance. Painful sex can sometimes be a sign or a symptom of pelvic floor dysfunction. Vaginal flatulence. I don't think we get to say this word often enough, queefing. So if you collect a lot of air and you're kind of doing a downward dog and realize you're releasing air from your vaginal canal, could be a sign of pelvic floor relaxation, not necessarily, but something to consider if it happens repetitively. So those are some of the more common signs. In males with pelvic floor dysfunction, they might have issues with erectile dysfunction and bladder issues as well.
So all things that you talked about that could really impact quality of life.
Exactly.
And things I hear a lot of people I know who've given birth, so women or people who've given birth, talk about like after birth, I pee when I sneeze, that kind of stuff. So sounds like that is a pelvic floor issue or a problem.
Yeah.
And so my question is, since it's something I hear, especially from my postpartum friends, how do pregnancy and postpartum specifically play into pelvic floor?
So there are different theories. It's not well proven, but the idea is carrying a pregnancy, delivering, especially if you end up delivering vaginally, whether it's without any assistance or with forceps or a vacuum, it causes injury in many situations to the pelvic floor, either through compressing, stretching, tearing some of the nerves, muscle, connective tissues, the fascia down there, all of which can lead to future pelvic floor injury.
Got it. And what are ways you can prevent these issues? So if you know that pregnancy is your goal or not, or you are post-pregnancy and aware of pelvic floor issues, what are ways that you can help prevent them from happening to you?
So there's limited data that anything can be done to prevent those issues from cropping up in the future. There were some short-term studies, I think, when I was doing a quick scan of the literature, that in pregnancy, if you're experiencing some urinary incontinence to the degree where you're watching a show or you listen to a joke and you actually find it funny and you laugh and you lose some urine there, trying to do some Kegel exercises. So we've all heard of Kegels, not Kugel, as my husband thought once, not Kugel, but Kegel, Kegel, where you try to consciously, just like you're flexing your muscles when you're lifting weights, like you're contracting your vaginal wall muscles to try to strengthen that support area. Again, does that help prevent long-term issues? Not really clear, but in most cases doesn't hurt.
Doesn't hurt.
Yeah.
I also saw one of the things on how to sort of prevent these issues is weight loss or being in a healthy BMI.
Right, so thank you for bringing that up. So some of the other risk factors besides pregnancy, because sometimes when we'll come in the door saying, I've never even been pregnant before, why am I feeling like there's a bowling ball in my pelvis? Obesity might be another risk factor. High-intensity workouts on a repeated basis. Potentially the theory there is because you're working out so hard, you're doing Orange Theory or Barry's Boot Camp every single day, increasing the intra-abdominal pressure, putting a lot of pressure on your pelvic floor. Might that lead to pelvic floor relaxation? Possibly. There have been some observation studies looking at people who do heavy weightlifting for their jobs, factory floor workers, lifting big boxes and stuff. Might they have a higher risk for pelvic floor relaxation issues? Possibly. So trying to, if it's not job related but fitness related, trying to change up your exercise regimen so there's more diversity in your day-to-day schedule.
And if this is not one of our questions that we talked about, but now I have an actual question.
Sure.
If you have pelvic floor issues, like any of these symptoms that you've talked about, to whom would you go? Is it your OBGYN, your PCP, pelvic floor therapist?
So all of the above. So I think it depends on your comfort level and expertise of your OBGYN. I'll be very frank. When I've had patients come to me saying, I think I have some pelvic floor issues, I want some further care because I'm leaking urine, I feel like this is not uncommon after delivering 2 kids vaginally. I actually have to manually help myself have a bowel movement because of that incontinence issue. So in those cases, I'll actually refer them out to a pelvic floor physical therapist or a urogynecologist colleague to see if they can also help them.
Okay.
There are also physiatrists, rehab medicine doctors, so those are also some other providers to consider.
Perfect.
Yeah.
Some studies suggest, this is something, we have a lot of fun when we record these DocTalks.
Yeah, right.
And some studies suggest that this is real, this is science, that twerking or belly dancing may be a non-surgical treatment for pelvic floor issues. And I will add that there's also really good data that shows that dancing helps with mental health. So 2 birds, 1 stone.
Okay.
Or 1 twerk, as it were. So
2 twerks, one bird, or 2 birds?
2 twerk, I don't know.
All right, whatever.
Dance
Okay,
is the point. So is it true that studies have shown that things like twerking or belly dancing may be non-surgical treatment for pelvic floor issues, and how could that be possible?
Well, so at 9:15 a.m. this morning when I was approached by my team, I said, absolutely not, that sounds ridiculous. But of course, sure enough, the Journal of Physical Therapy Science in 2017 published a randomized study of 24 middle-aged women, and 12 of them were assigned a 12-week program of belly dancing.
Can I talk about the moves that they did?
Yeah. And actually, if you could demonstrate for me, because I'm still kind of stymied. Yes, go ahead.
I'm just going to talk it through maybe for this time. They did leg shimmies, body shimmies, pelvic tip.
Yes.
Here we go. Hip drop lift, hip slide, hip thrust, circle, bump, twist. So they did full...
You dropped my favorite one, the choo-choo shimmy.
Choo-choo shimmy.
What is it, like this?
Yes. This is a fun fact about Dr. Choi. This is not scripted. I think many of us know that your OBGYN or your REI, the doctor you see, when you're on the table, they have a specific thing they said to get you closer to them. She says shimmy on down.
Yeah.
Yeah. Other docs that I worked with said scooch. You always said shimmy. So maybe you were calling.
Maybe I was actually killing two birds with one stone.
Exactly.
With one shimmy.
So you looked at this study around dancing, belly dancing around pelvic floor, and what did you find?
So what this research study showed was that after 12 weeks, the belly dancing group had improved pelvic floor health, increased vaginal wall strength. I'm not really sure how they measured that, but I know there are tools out there. Now, again, one small study, 12 individuals worldwide, but can't hurt. And if it brings you joy in your life and helps with your cardiovascular health and with weight maintenance, why not?
Yeah. Exercise can be really boring and monotonous for people, so different ways of exploring movement I think is fun.
Especially if you get to do the hip and choo-choo shimmy.
Yeah,
and the figure 8 rib cage. I'm going to work on that.
This is my favorite DocTalk so far. We can link to the study if anyone is interested. That's a wrap for our pelvic floor conversation.
Thanks, Lisa.
This was fun.
This was a lot of fun.
It's not every day you get to say choo-choo shimmy.
Yes.
That's a wrap. So it's clear that while this topic may seem really specific, talking about these issues, especially understanding sort of the symptoms and the impact they would have on quality of life, and I think especially understanding that these are things that not everyone might be comfortable talking about.
True.
And so maybe experiencing but have no one to share them with. So I'm glad that we were able to talk it through. I hope that we continue to have these types of conversations. Mm-hmm. And if you have thoughts on things that you might find interesting to talk to a doc about, please let us know. We're always looking for good content. And as always, it's a pleasure to doc talk with you.
Yeah.
Thank you.
Till next time.
Bye.